I had just graduated from college with a nursing degree, and I went to the doctor and there was a lump in my neck that hadn't been going down. I went for an ultrasound and then they sent me to a surgical oncologist and they did a biopsy there. The findings were Hodgkin's lymphoma. We met with Dr. Roth and right away I was like, I want to be treated here. Totally connected with her and Stephanie, both the PA. Dr. Roth was amazing. She was also a Hodgkin's lymphoma survivor. Immediately I just felt like a connection, like she knows what I'm going through. I think for the first time since the diagnosis, I could take a deep breath and be like, it's gonna be okay.
Hodgkin lymphoma is the most common cancer type that we see in adolescents and young adults. The adolescent and young adult, or AYA age group, is defined as age 15 to 39. And these patients often have unique needs that are a little different than the younger pediatric population or the much older adult population. The AYA Lymphoma Program at Weill, Cornell, and New York Presbyterian focuses on addressing both the medical and the psychosocial and supportive care needs of young people who have been diagnosed with lymphoma. A lot of the focus that we have in Hodgkin lymphoma is not just curing our patients, but doing so with a treatment plan that focuses on minimizing toxicity with the mindset that this is someone who has many, many years of life ahead of them. We also have a team of supportive care specialists able to help in navigating taking a leave from either school or from your job, how to navigate changes in relationships at this challenging time, and then helping them get back on track as we get towards the end of therapy and transitioning back, leading a healthy and normal life just as they had planned before their diagnosis. I was diagnosed with the exact same lymphoma type that Katie had. We could relate in ways that are kind of different for the doctor-patient relationship. Katie would often ask me, what did you do when you were nauseous? Did you lose your hair? And what did you do about wigs? And so I was able to provide a little bit of additional support for Katie as she was going through this.
Right before I started chemo is where I kind of just sat back and thought about it, and I was like, this is big. This is gonna impact my whole life, and I can either choose now to make the worst of it and just be a miserable human being, or I can make the best of it. I'm a funny person. I like to use humor in my everyday life, and I want people to know that even though I just got diagnosed with cancer, it's okay to laugh. So I think that was kind of what made me want to start my blog. It was called Tuesdays with Katie, and it was called that because I got chemo on Tuesdays, and I wrote about my experience at chemo. I wrote a lot about my experience with my hair falling out. It was a hard experience, but I could make light of it, and putting humor to what was going on was very therapeutic to me.
Katie would always come into my office with a smile on her face. Even if she was having a bad day, she would find a way to put a funny spin on one of the side effects she was experiencing. This experience has just added to what she is able to offer to her patients.
Knowing what it's like to be a patient puts it into perspective for me. They're scared, they don't always know what's going on. They need someone to help them through their days in the hospital. When I was getting my chemo and my head was on the table, the nurse was there to put a pillow under my head and pat me on the back and say, you're almost done. You can go home soon. I want to be that person that's going to give someone a pillow, and I want to tell them that they're going to get through this. I couldn't be more thankful for Dr. Roth and Stephanie. At my last doctor's appointment, they were like, oh, so do you have any questions? I was like, when can I come work for you guys? I would love to just be a part of the care team that took care of me one day, because they're just amazing.